Today marks the second day of a 5-day warning strike by the National Association of Resident Doctors, despite efforts by the federal government to intervene. Resident doctors play a key role in Nigeria's healthcare system, particularly in emergency wards, and are critical to delivering quality healthcare nationwide. Following a National Executive Council meeting on Wednesday, NARD members unanimously resolved to proceed with the 5-day warning strike. The action follows an earlier 10-day ultimatum that expired on September 10 without reaching a resolution. Well, to give more insight on the demands of resident doctors in Nigeria, we will join Dr. Douglas Emeka Okor. Dr. Douglas is a consultant neurosurgeon and Nigerian health sector reform advocate. Thank you for joining us, Doctor. Good evening.
Hi, good evening, Stephen. Thank you, Advocate.
All right, Doctor. What are the main challenges currently faced by resident doctors? Why are they going on strike?
Like me and the resident doctors which we want to talk about now, they all have similar challenges. So these challenges include, number one, delayed and unpaid salaries. They are not even paid proper wages when you compare to other countries, even in West Africa and other parts of Africa, in talk less of maybe going out, looking at Europe and the Americas. Okay? Poor working conditions, infrastructure, in terms of looking at equipment, looking at the kind of commodities, consumables that you will use is a very big struggle, okay? Very low hazard and risk allowance, okay? These are healthcare providers that put themselves in harm's way, deal with the tissue that can get infected and all that, okay? And clearly, when you look at the general welfare of things like housing, things like transport, things like schools for kids, right? Things like even healthcare insurance for the healthcare providers themselves. There's a struggle across board when it comes to all these things. And that's why you see that the average Nigerian doctor, the average Nigerian young doctor would want to actually, if they have the opportunity, actually leave Nigeria, the Japan that we always talk about.
All right, Dr. Okor, is there no other way to go about this rather than this strike? No other efforts were made by the resident doctors to reach an agreement before resulting in this?
Well, so I think traditionally, I think most of the associations and bodies, professional bodies in Nigeria, I think they've come to a point where they now feel that looking at our political office holders, that the best way to actually hold their feet, actually try and push them to actually do what they need to do, and actually go ahead and some of the things that they've actually agreed upon, actually implement them. I think most organizations and most associations and most bodies actually feel that going on the strike and putting the fire to their feet is actually the only way that they actually get through to the government and the political officers. So I guess that's why they would rather do that. Is there any other way? Yeah, possibly, but most of the time there is a struggle when it comes to actually thinking whether our governments at national and subnational level, whether they actually understand the importance of things like health can actually put their thinking, their actions, and their spending to it. So I guess it looks like within our climb that we're actually stuck with most associations actually wanting to actually go on strike, and they feel that that's the only way that they can actually make governments actually do the needful.
Okay, what long-term solution would you suggest to improve the working conditions of doctors in the nation's health care?
So clearly, first of all, it's not just looking at just the welfare or looking at working conditions of healthcare providers, specifically talking about resident doctors now. It's just looking at healthcare generally in Nigeria. You just talked about these particular initiatives that they were launching now. See, we've passed the stage of launching things, launching initiatives, making proclamations and stuff like that. The talk shop is just too much when it comes to the realities of actually truly making those interventions and those programs that truly impact across when we look at the different components of our healthcare system. To tell you the truth, we are in a sorry state. Okay, and we're not getting enough. So the proper investment in all the key areas and components of the healthcare system is what we actually need. Specifically now, we're talking about the healthcare workforce and actually drilling down to actually looking at the resident doctors who are actually postgraduate trainees to become specialists. That's what the resident doctors are actually. They're actually postgraduate trainees to actually become specialists. Like me, I'm a specialist, I'm a brain surgeon. Okay, so when it comes to what do we need to do, we need our governments to understand that when you look at the sustainable development goals, out of 17 of them, number 3 is healthcare. And so that means that when we are actually putting our resources and making decisions about what we need to do in terms of governance in Nigeria. Healthcare must be one of the key things that they must mainstream. Like I said, I don't know who you do, but all the components of healthcare, specifically the human resource for health, they must put their resources and all the strategies that we need to actually
All right.
make it better for our healthcare workers.
All right, Dr.
specifically the
Okor,
residents.
thank you very much for your time. I do hope that this is resolved amicably because it's a matter of life and death. Thank you very much for your time.
Thank you, Sifo.
All right.